So, come on, Laura Rose. I'm so delighted to see you. And I just wanted to show you our clinic and show you around everywhere. So, here is the reception area where patients walk in, and we try and keep it really warm, really friendly. We've got lovely lights. That's actually a blastocyst. It's a commissioned painting. We are one of the last remaining independent IVF clinics in the UK, and we're family-led, which is very unusual. We're very keen to have gender-neutral signage and gender-neutral toilets, and as you can see, we've been very careful about the persona, how we've drawn them, so they're non-triggering.
And I think that's really nice because it means that people feel that it's a safe space, it's inclusive and it's for everyone, it's not excluding anyone. I think a lot of LGBTQA plus patients go into a lot of spaces and find them very heteronormative and feel excluded. So I think things like that are just really small but really meaningful changes.
We do the same, so when they first register, we ask preferred pronouns, how they'd like to be called, and all of our forms are gender neutral. They're really sensitive.
It's really important.
So we have designed the clinic over the 4 floors. So this is the Moonlight Suite. We have some consulting rooms, but downstairs is where we do our monitoring. We have our scans, our blood tests.
What's with the names? What do the names mean?
The names are specifically from fertility symbols, fertility deities, but from all over the world and from all the different cultures, so that nothing is triggering. You don't go into consulting room 1 or operating room.
Clinical, doesn't it? And sterile.
And that's, if you're trying to have a family, you're not ill, you just want some help. And that's why we want to try and make people feel very welcome. We've got Aristotle is a consulting room up on the 1st floor where we have also our cryo storage area. So down in the Sunshine Suite, with just quite a lot of uplifting words to try and bring people, into a positive mindset as they come into their IVF or other treatment cycle, and they have their monitoring. So let's pop downstairs. Hello. I'm just showing Laura Rose around. So here is our room where the patients will be waiting. We sometimes have the TV playing, but you'll see that we've been very careful to make sure that all the different patient groups are recognised in our material, our posters, and it's important for patients. We have little books here, so we put out books that they can then ask us a little bit about those stories we've got. So heterosexual parents could read about this, so describing IVF, but also same-sex couples have the same.
And representation is really important because on a trying to conceive journey, it's really full of anxiety. People are scared, people are fearful. Are they going into a space that's going to reflect them and represent them? So to see yourself reflected back in the collateral, like it feels meaningful and it feels intentional, doesn't it?
And it was really carefully thought through, because I moved into this space 3 years ago, having designed it from the ground upwards, and so I thought of everything. And we'd had conversations, and I've learnt from my patients.
Yeah, that's the best thing to do.
So we're going to go up here now to the Rainbow Suite on the top floor, which is where our patients have the actual egg collection and where the laboratory is. I have patients obviously having egg collection, but I'd like you to come and see our laboratory. Our embryology laboratory is in here. It's a very busy place, and they're all doing their different pieces of work, and we've got a big team at the moment. That's our director of embryology, and we've got a lot of egg collections happening today. PGTA biopsy happening. They're all coming out to say hello. There we go. And there's.
But it's great to see where the science and the magic happens, and knowing that life is being created in that room.
Yeah,
it's amazing.
But they're obviously we can go in there, but I think they're so busy. I think we're going to leave them to do what they have to do. Again, you can see really good representation. We don't, we don't have male production room.
No.
We have got very sensitive names. So we've got Damara, Loki and Hathor are the places where people can produce.
So there's so much thoughtfulness behind all of the names to make sure it's inclusive.
And none of the rooms have heteronormative pictures, or they're very sensitively thought through.
I love that.
Yeah. But we'll just go and have a quick look at our cryo store, because you probably remember from last time I designed this so that children who grow up can come and visit, and I've got a few visits coming up. They come and visit the clinic and understand how they came to be.
Yeah.
And so we can put little boxes here and they can stand up and they can see this is a cryostore room, and they can see the tanks there that people can peer through and see. That's where we keep the eggs, the sperm and the embryos.
That's
It's very
amazing, isn't it?
special.
To be able to see and know that yours may be in there, maybe
Yes.
frozen, ready to
Yeah.
start life.
And for some of the children who know that they came from a frozen embryo, they say, "Oh, that's how I started.
That was where I was.
That was where I was," which is lovely.